Okay, well, we're going to get started. My name is Larissa Gadsby. I'm the co-chair of the Nurse Practitioner Interest Group, as well as the Region 4 representative to the Board of Directors. I'm really excited. I'm also a nurse practitioner. I work in pediatrics at McMaster Children's Hospital. I'm so excited to have you all on the line with us tonight for another NPIG Insider. So welcome. And the NPIG Insider is a monthly webinar series for NP members of RNAO to network, share, learn, discuss, and collaborate on topics relevant to NP practice. A reminder just to everyone that webinars are on the fourth Wednesday of each month from 5:30 to 6:30 p.m. So you can mark those in your calendars so you don't miss any upcoming webinars. So we're very excited for today's topic. Today's topic is NP Fellowship Opportunities, RNAO's Advanced Clinical Practice Fellowship. And we are joined today by Erica D'Souza from RNAO and Bethany Stevens, an NP who worked with South Lake Regional Health Center. Bethany recently completed a fellowship on intraprofessional collaboration and knowledge translation for the inpatient surgical unit, the creation of the nurse practitioner role. We will hear from Erica first on more about RNAO's ACPF program, and then Bethany will share the highlights with us from her experience and learning as an ACP fellow. So welcome everyone, and I will turn it over to you, Erica.
Thank you. Good evening, everyone. My name is Erica D'Souza. I'm a project lead for the ACPF program. In today's presentation, I will be going over some of the application requirements and sharing key resources that will be helpful if you choose to apply. During today's webinar, we will briefly review the ACPF program, the requirements, and how to apply. I will review the proposal success sections, share key resources, hear from a past fellow, and answer any questions you may have. So let's get started. What is the Advanced Clinical Practice Fellowship? ACPF is RNAO's fellowship program, which is open to both members and non-members. It has three main benefits. First, it allows for a unique opportunity for RNs and MPs to meet a specific learning need through the support of their organization and RNAO. It fosters a nursing mentoring opportunity, as one of the criteria for this fellowship is that the applicant works with a mentor. And finally, it helps the nurses' organization improve patient care by way of an educational development of their nursing staff. Now let's have a quick look at the ACPF by the numbers. The RNAO issues 2 request proposals every year. All these dates and deadlines can be found on the RNAO website. Fellowships are 450 hours in length and may be completed on a full-time or part-time basis. Each successful applicant will receive $15,000 in funding to complete their fellowship. The applicant's organization must commit to a minimum of $5,000. This must be in kind or in monetary contribution. There are 4 different types of streams of fellowships that applicants can choose to complete. There is clinical, which focuses on the development of clinical skills, knowledge, and expertise. Leadership, which focuses on the development of leadership skills in the areas of education, management, research, and policy. Best practice guideline implementation. This focuses on the development of skills and activities related to the implementation of RNAO's best practice guidelines. And the final one is AMS RNAO, which focuses on developing skills in providing humane, compassionate, and person-centered care. You can find more detailed information about each stream on the link provided on this slide. There is also a choosing stream sheet on the website that is helpful in determining which fellowship stream to focus. Now that we've gone over what the fellowship program entails, let's talk about requirements. In order to be eligible to participate in the fellowship, you must be working as an RN or NP in Ontario, have at least 1 year of nursing experience, be employed on a full-time or part-time basis, and able to dedicate 450 hours to the ACPF learning experience, have available mentor or mentors in the areas of focus, and have employer support. This means having adequate financial and material support. A minimum of $5,000 contribution is required, from the sponsor organization. This could be in-kind or monetary contribution. There must also be a culture of learning in which the fellow has the support necessary to succeed. Let's move on to the application process. The application process is now easier than ever. Step 1 entails reviewing the RFP. This document outlines the necessary requirements and components of the proposal application. It is very important to review this document before you apply. The RFP outlines exactly what should be included in each section of the application and is extremely helpful in submitting a successful application. I would encourage applicants to use the RFP as a checklist when reviewing their application before submission to ensure they have included all the necessary information. Step 2 is the intent to submit. This is a mandatory part of the application, but is not binding and can be modified after submission. Step 3 is completing the online application. Applicants may choose to complete the application template first and then enter your responses once they're finalized. We've moved the application to an online format and will no longer be accepting hard copies. The application is the next step. The proposal is broken down to 7 sections, each weighing a different percentage. As you can see, the learning plan is worth the highest. This really is what the applicant will lay out their objectives for the fellowship and articulate what it is they would like to accomplish through the fellowship. We suggest applicants start their application by completing their learning plan. Once that's complete, the rest of the application becomes very easy to finish. There is a learning plan checklist available on the website for applicants to ensure that all the necessary requirements for the learning plan are met. Supporting documents. Applicants will need to submit the following documents to accompany their application: the applicant's resume and CV, letter of support from the applicant's direct manager, letter of support from the applicant's senior manager, letter of support from the primary mentor, and resume or CV for the primary mentor. Now that we've covered what to include in the application, let's move on to the review process. Proposals are reviewed by an external review committee comprised of nurses, and each proposal is reviewed by 2 different reviewers. In some cases where there's a need for consensus, inter-rater reliability testing is done, which may involve a group of reviewers. Once the review process is complete, applicants are notified whether their proposal has been accepted or declined. Detailed feedback is given to all applicants regardless of the application outcome. Selections made by RNAO are based on score, funding availability, and revision requirements. Development proposal resources. RNAO has a number of resources to assist applicants with the proposal development process. There are a number of fact sheets and tip sheets available to assist applicants throughout the application process. They include a tool to assist in choosing a stream, including examples of fellowship topics for each stream, the learning plan checklist. This is a key to making sure your learning plan is successful. Applicants are encouraged to use this tool throughout the development of their learning plan. A fact sheet for nurses. This is a quick overview of the program and its benefits and really what's in it for you. And a fact sheet for sponsor organization and mentors. This would be helpful for both the applicant and either the mentor and the sponsor organization, as it outlines the benefits and expectations for both parties. These are great to use when approaching a mentor organization or involvement. We also have a number of informational videos and webinars to assist you in the application process. Topics include choosing a stream, developing your learning plan, RNAO AMS fellowship information session, and the ACPF overview information session. You can find the following on the ACPF page of the RNAO website. The request for proposal guide. Again, this is really key in outlining what to include in your proposal. This document also details the review process and highlights other key details regarding funding. If you would like to see an example of a successful proposal, you can send your request via email. Another helpful resources are the executive summaries. These are helpful in a number of ways, whether you aren't sure what stream to pick or how to roll out your fellowship plan. These executive summaries are an excellent resource for applicants in any stage of their application. Lastly, I'll go over some important dates. The next request for proposal is March 4th. The deadline to complete an intent to submit is by May 6th. The deadline for proposal submission is May 17th at 3 p.m. The review process takes approximately 8 to 10 weeks, and you'll be notified of the status of your proposal no later than August 8th. You cannot propose a start date earlier than September 4th, 2019, and your fellowship activities must be completed by February 1st, 2020. Does anyone have any questions?
Great. Thank you so much, Erica. That was an awesome overview of the program. If you have any questions, you can feel free to include them in the comments box in the webinar platform or unmute yourself, and we will address them. So if there are no other questions, then we will move on to Bethany.
Okay, just a note that Erica will be on the call for another 15 minutes. So if you have any questions about the ACPF, now is the best time to ask. If after that time, then she won't be available, but you can always send us an email and we can respond to you via email afterwards. Bethany?
Okay, yeah, Bethany, go ahead.
So hi, everyone. I'm Beth Stevens. I was a lucky recipient of an ACP fellowship that I completed last year. I finished in November, so it's still fairly recent. And my focus was on a specific unit, and we named the fellowship Intraprofessional Collaboration and Knowledge Translation for the inpatient surgical unit, with a focus on the creation of the nurse practitioner role. So I'll briefly talk about how the fellowship was instigated, how we established the need.
Sorry, Bethany, can you share your screen so we can see the slides?
Oh, sorry.
Awesome. Thank you.
Sorry about that. Technology is not my forte, so. Okay, so discussion topics. Like I said, how the fellowship was instigated, establishing the need, relationship building, envisioning the future, and how the fellowship can be beneficial for NPs. So how the fellowship came to fruition. It was instigated by South Lake Regional Health Center's first nurse practitioner, not myself actually, who is Marianne Beardsall. This individual paved the way for many nurse practitioners to come within the institution, and she was a previous ACP fellow, which is really important. In the current role as the Director of Surgical Services, she recognized the value-added benefit to the nurse practitioner role. The unit had recently transitioned through a tremendous staff turnover, which left many inexperienced staff to care for increasingly complex surgical patients. Inpatient surgery was in dire need of a continuous advanced practice role and clinical leadership. So coupled with changes in the current healthcare system and the lack of any residents or fellows at my institution, it was felt that the organization could support the continued emergence of the NP role to provide patients with accessible, comprehensive, high quality, cost-effective, and efficient care. So establishing the need, like I said, there was a lot of staff turnover, unfortunately, and a lot of inexperienced staff. This coupled with lack of continuity in leadership created a lot of issues for staff or patients. And anecdotally, there had been a long-standing poor communication between the nursing staff and various surgical disciplines. So the working relationships were quite hindered, and of course this ultimately impacts patient outcomes. So creating a link between the disciplines by fostering an environment of respect and understanding was a goal for the fellowship. So what we already know about the nurse practitioner role, there's been many studies showing the effectiveness of nurse practitioners. They're consistently demonstrating high quality care and always high patient satisfaction. And although I couldn't find any studies involving general surgery nurse practitioners when I started the fellowship, there were many studies put out by cardiovascular surgery nurse practitioners and thoracic who had documented successes with the implementation of their roles. And one Canadian study in particular, performed by Goldie, Protham, Bali, and McKay, demonstrated that care provided by nurse practitioners in comparison to hospitalists had similar outcomes and greater satisfaction in certain aspects of care delivery. So relationship building, that was quite important for this particular unit. This role did not exist on the unit, so defining scope of practice was really imperative. It was an ongoing conversation I had from day one with all staff to the very end, what the nurse practitioner could or couldn't do. I enjoyed having the conversation. It sparked a lot of different topics. And as I had worked for a registered nurse for many years on the unit, something I did encounter was hesitancy, mostly by the nursing staff to see me in this different role. Even some of the nurses that had trained me, I think it was something they had to kind of get used to. But once they had seen the benefit of the nurse practitioner, the continuity and availability, their dispositions definitely shifted. And as no role had yet existed, it took time to see how it could evolve. There's a lot of potential once the scope of practice is and will be better understood and a formal role introduction has been implemented. One thing that was really important too with regard to relationship building was establishing relationships with other nurse practitioners in the hospital for support. So before the fellowship actually started, I had the opportunity to shadow, I think, 4 or 5 different nurse practitioners just to see how their days were constructed and the challenges they encountered on their specific unit. So that was really important and a great opportunity. So knowledge translation. As I said, I got to work with several nurse practitioners in the hospital. How I did the translation of knowledge was via PowerPoints, lunch and learns. What was most important for the translation was having a daily discussion with each of the primary nurses, discussing their assessment findings, care plans, keeping the communication constant. And another opportunity I really enjoyed was working alongside some of the vascular surgeons, having some one-on-one teaching with wound care, and also with the ostomy RNs. So envisioning the future of this particular role, because of the fellowship, it's looking very good. There was a great acceptance of the role from the whole surgical team. I work quite closely with the pharmacist, the dietitian, the discharge planner, and all the surgeons, so it's looking quite good. The proposal for funds, we included survey results and documented a decrease in patient complaints during my fellowship. So that was something quite huge that the director and my mentor could bring forth as a means to get this position permanent. And there's actually a posting for the position right now that I'll be interviewing for in about a week or so. So I think we were quite successful. So part of what I did for the completion of the fellowship was to survey all staff, pre and post. And the feedback was very good. As you can see, there's some of the quotes from these This is from the nurses. One quote from a particular nurse stated, "The nurse practitioner was a great asset to our floor. It was most beneficial that she was on our floor and very easily accessible. I found it very beneficial to have someone to quickly run questions or concerns by and or get orders for small things instead of having to page the doctor and hope they call back in a reasonable amount of time. It was great having someone on the floor that could write an order, for an example, like a grab all, rather than waiting for the doctor to answer a page. It saved a lot of time for both the nurses and the doctors, and not to mention put patient-centered care first." Oops, sorry, I forgot to advance the slide. So this is the Intraprofessional Survey Results. So this, I asked the dietitian, the pharmacist, and the surgeons to give some comments, what was good, what was bad, what could be improved. Those are two of them there. And another one was just a brief quote. "Having Beth as a surgical nurse practitioner was a true asset to the unit. Would love to see this become a more permanent role." So the benefits of a fellowship are huge. For me, what came to mind was the opportunity to address the shortcomings of an institution. A big one that we always talk about are addressing barriers to practice. So having that ongoing discussion, scope of practice and showing how successful this role could be. Another was to improve patient care and satisfaction, improve staff satisfaction. Personal growth was huge. I had been nursing for about 10 years and relatively a brand new nurse practitioner, only about a year of experience. So this was huge. And that ties into professional growth and then relationship building, of course. So that's all I have to say. Basically, it was a huge opportunity I'm very grateful for, and it's going to be career-changing, and I look forward to the future. So I encourage anyone that's thinking of doing a fellowship to take the steps and take the time and harness this opportunity. So that's all I have.
Awesome. Thank you. Thank you so much. Does anyone have any questions? Okay. I have one, Beth. How did you find it was approaching your employer with this fellowship idea?
Sorry, can you say that again?
How did you find the startup discussions, with your workplace and your employer in terms of getting their support and buy-in for this fellowship?
I was very lucky, actually, in that I was already working at another job, actually, at NPLC. But I stayed casual at the hospital, and I was actually approached by upper management. So it came to me, and I was very lucky. So I obviously was quite supported. I think that's quite huge to have the support of, management and have really strong mentors.
Yes, for sure. Does anyone else have any questions or thoughts?
I missed.
Okay, well, this webinar will be archived for anyone to be able, any of our members to be able to go back and take a listen through. And so as questions come up, I'm sure that we will be able to get those through the Interest Group website, and so we can try to connect people as they come up. That was wonderful. That's really great to hear how this fellowship was specifically applicable to the NP role, which is really, really cool. So that was great. Thank you so much. So just two quick things before we close this evening. For next month, there will not be an NPIG webinar in March, as RNAO is hosting the very first Nurse Practitioner Institute from March 19th to 21st in Niagara-on-the-Lake, and this event is open to all nurse practitioners and nurse practitioner students. We hope that we'll see many of you there, and registration is still open for this. You can check out the event page for more details, including the agenda that's been posted, and we have some amazing speakers lined up for this event. The website is rnao.ca /NP-Institute. And our next webinar will occur on April 24th, so stay tuned for communication from RNAO and NPIG on the next webinar. And as I mentioned before, that all of the webinars are archived on the NPIG website for your reference. Also, the last quick thing is that make sure that you follow NPIG on Twitter and Facebook to make sure that you stay up to date with the latest happenings for the interest group, as well as issues related to NP practice. And if you have any questions, you can feel free to reach out to me anytime. My email is lgadsby, GADSBY @rnao.ca. So thank you so much, everyone, for joining us tonight. I hope that you enjoyed the presentation as much as I did. Thank you so much to our speakers, Erica and Beth, for their time. And I wish you all safe travels home.